Business Matters, presented by the Guamanian Magazine.
When the Guam Regional Medical City opened for business 2 years ago this month, it was the first new hospital in 4 decades. And as it winds down the celebration of its second-year anniversary, Medical Director and Chief Operating Officer Dr. Mike Cruz is more convinced than ever that there is room for 2 hospitals here if they aim to be complementary. He says GRMC is focused on providing treatment locally for 3 predominant health issues: strokes, heart attacks, and cancer, so patients aren't forced to leave island for life-saving care.
We're developing all of those programs, and one of the things that we want to be able to work with GMH, for example, is there are some things that you can do better than we do. You know, maybe they do deliveries and they can take care of babies better than we do, and some things that we can do, and so 2 hospitals are sort of focusing on what they do best, and without having to compete, so that the resources can be maintained and allow for both hospitals or the other hospitals here in Guam to survive.
For Dr. Cruz, all 3 of these diseases have hit close to home. The former lieutenant governor was at a political rally several years ago where his mom suffered a stroke that left her paralyzed on one side. Unlike his mom, he says key treatment is now available, like for a recent patient at GRMC.
Dr. Jeff Shea, our neurointerventional radiologist, was able to use some of the great skills and the equipment that we have here, and was able to do some things to revascularize her brain. And she walked out without any of the residual effects of a stroke or the paralysis that she would have suffered, several years ago without the staff and the technology to be able to do it.
Cruz also has a family history of heart disease. His grandfather died of a massive heart attack at 47. His father died the same way at 45. And Cruz's younger brother had his first heart bypass at just 35. He said GRMC will once again have a cardiology center that was shut down last year by a lack of specialty nurses.
I'm glad to announce that we're going to be picking that program up in the next week. And in fact, we just hired on a director for our interventional cardiology lab who's going to be starting up. We have 2 additional other interventional cardiologists that are going to be starting the program back up. We've been in conversation with Dr. Noel Concepcion, who's been patiently waiting back in California for the chance to come back again and give back to his island, because as you know, Dr. Concepcion is originally from Guam.
Cruz says GRMC has also established a cancer center to treat the 3rd of the big 3 diseases. And again, it became very personal when a lump was discovered on his child.
It turned out it was a cancer. And so my wife Jennifer had to live in Los Angeles for almost 6 months as my daughter had to go through the long chemotherapy and the treatments that she needed to go through. Now, obviously, I had the means by which we could do that. But for most of our families in Guam, where do you get a chance to have to be able to have the means by which you can go off island and have an extended stay somewhere else as you try to get the care to your loved ones or to yourself?
Cruz says GRMC's Center for both Medical and Radiation Oncology is doing very, very well. It strengthens his belief in the mission of the facility, and overall, he says, the statistics also bear him out.
The 150 beds that GMH had was inadequate for the population that we have today, and certainly the population that is anticipated to grow as Guam grows with the military buildup and other things like that. And so, as an example, we've opened an additional 10 beds, and as of today, just today alone, we have 97 inpatients. So we're not taking away necessarily from GMH, but there's additional need for beds, and so we're basically at 100% occupancy today. And so we're helping certainly to address the acute need for the shortage of beds here on island.
But he admits that operating the new hospital these first 2 years has not been without its challenges, especially as a private business that relies only on its revenues.
With the new hospital, we don't have the government subsidies, obviously, that will sustain us beyond. And so we're going to have to make a case that the cost is what it is. And so we've made that case with Medicare, and we're getting a per diem TEFRA rate that is significantly more than GMH. And that's caused, I think, a little sort of sticker shock with some of the insurances. And it's a matter of working with them contractually to see what we can do to ensure that, again, the hospital survives. There's no doubt in my mind that the people need this hospital.
Dr. Cruz says he considers GMH, where he still also works, as a partner in the local healthcare industry, and he welcomes the government's latest attempts to help it out through a modernization plan and a dedicated tax subsidy source.
Again, as the governor has said to us and me, is Mike, there's not a need to be competitive. What can we do to ensure that both hospitals do well and survive?
For KUAM's Business Matters, I'm Nestor Lecanto.
Business Matters, presented by the Guamanian Magazine.